these patients are very heterogeneous. Of course, we have first to take care of how the disease presents at relapse in terms of POL24, in terms of stage, in terms of clinical aggressiveness, and also you have to take care of the patient, because it's different to treat an old patient versus a young patient or a patient with comorbidities. In these very complicated scenarios, we still have the option of chemotherapy-based regimens such as the Obinutuzumab bendamustine regimen, but most of the interest is now focusing on chemo-free regimen. Of course, the R2 combination is one of the most popular, is quite well tolerated, and it provides quite a long follow-up, quite long progression-free survival times, which is extremely important. Autologous transplantation is also very much discussed in this setting, because there are old data indicating that this approach was useful for this patient, but more recent data somehow allow to have some doubts, at least, on the benefit of this treatment. In this setting, especially if you go to the to the second relapse, immune engagers, T-cell engagers are becoming more and more important. We do have bispecific antibodies, particularly monoclonal, which appears to be very effective and very useful, as well as CAR T cells, which also appear to be a promising tool in relapsed refractory follicular lymphoma. This is still not enough, because we also have a lot of combination trials, such as the Rosewood trials, showing the benefit of Obinutuzumab plus Zanubrutinib. So probably there will be a very complicated time which we are going to define which is the best approach for every single patient. And of course, it will be very important to test a new combination and have answer on how to handle patients, especially in terms of a combined approach, and also in terms of approaches that will not last forever, because also in follicular lymphoma it is now time to consider treatment which are not continuous, because of the need of the patient to be treatment-free, and also for economic reasons that will be very, very important. Therefore, a very complicated issue that needs to be discussed very carefully, but with really a lot of therapeutic options. It is the scenarios change a lot compared to 10 years ago, when the options were very few. Now we really have a lot of possibility, and a slow but steady shift toward the use of chemo-free regimens in this setting.